Welcome everyone to the first session of Partners in Pain, a Yorkton and area community event. Thank you all for being here. We'd like to start today with a land acknowledgement. As we gather here today, we acknowledge we are on treaty territory. Some of us are joining from Treaty 6 in the homeland of the Métis, while others are joining from Treaty 4 territory. We pay our respects to the First Nations and Métis ancestors of this place and reaffirm our relationship with one another. The Partners in Pain events came about as a result of the Improving Pain in Saskatchewan collaborative research project. This research project aims to give pain a voice by bringing people together to share information and plan action to improve how pain is managed in Saskatchewan. The research team started by interviewing people who live with chronic pain, the people who support and help them, as well as healthcare providers and healthcare decision makers. So far, over 140 individuals have been interviewed. Interviews and discussions with folks living in Yorkton and area led to the development and planning of this series of events. The Partners in Pain events are an opportunity to bring us all together to learn more about pain, hear the personal experience of someone living with pain, and try out an activity to help manage pain. Today's theme is an introduction to chronic pain, or Chronic Pain 101. We'll start with a presentation on Chronic Pain 101 with Dr. Susan Tupper. Susan is a physical therapist with a PhD in community health and epidemiology. She works for the Saskatchewan Health Authority as the strategy consultant for pain quality improvement. Susan is married with 3 adult children and an unruly sheepadoodle puppy named Dooley.
Hi everyone, this is Susan Tupper. So I'm a physical therapist and I work for the Saskatchewan Health Authority as the strategy consultant for pain quality improvement and research. And I'm very pleased to be able to present today on how chronic pain works, so Chronic Pain 101. And I appreciate the invitation from the Yorkton Planning Group for the Partners in Pain workshop. Chronic pain is one of my favorite topics. I think that it's extremely fascinating. But also it's really important, I think, for people to have a good foundational understanding of how pain works, because how you think about pain and how you understand how pain works can actually change your pain. So I've lived with chronic pain for the past 37 years of my life, and so I bring this information to you as someone who lives with pain, but also as a healthcare provider, as a physiotherapist who's treated thousands of people who live with chronic pain, and as a pain researcher and educator. What we know about pain, especially chronic pain, has changed so drastically in the last 10 years. And a lot of the changes in our knowledge about pain have come about because of new research technologies. There are new brain imaging tools and new ways of observing the nervous system and how it works to show what's happening when we feel pain and what's different about chronic pain. For many people, their pain begins with an injury or a disease begins or an infection in the tissues. And so it's very easy to think that if they still have pain 6 months or a year or 10 years down the road, that there must be still something wrong with them. Maybe the tissues didn't heal right, or the disease is getting worse, or maybe the doctor missed something. But we know that every person's nervous system acts in a unique way. So 2 people can have the same injury. One person doesn't feel very much pain at all, and the other person feels a lot of pain, and that pain goes on to last for weeks or years after the injury. And the difference between those 2 people is how their nervous system responds to the event and what else is happening for that person. So one major change in our thinking, what we know about pain, is that pain actually isn't produced by damaged body tissues. So rather, pain is produced by the nervous system, and it's part of a very complex defense mechanism or defense system that's trying to protect us from harm. So it's probably more accurate to say that pain is your brain's way of trying to get your attention because it thinks that there may be something dangerous and that you might need to do something about it. Pain is extremely motivating. It's really noxious and unpleasant. It makes us pay attention and change something that we're doing. And that warning signal in an acute pain situation, when you first injure or you sprain your ankle, something like that, Well, that's a really helpful message to tell you to rest and to take care of your ankle, to find ways of recovering and finding relief. But the message is no longer very helpful with chronic pain. It's no longer a really realistic warning signal when it's months or years down the road. But pain, even chronic pain, can still be a motivator for behavior change. So it's important to keep in mind. So for people with chronic pain, the nervous system is typically on high alert. So their nervous system is really good at producing those danger messages, which are pain, but they produce more than they need to. And they can have a lot of pain even when there really isn't a threat of harm. So I want to describe a couple of research studies that illustrate how this works or how this may play out. So the first study that I want to tell you about was done in Australia by some researchers. Lorimer Moseley is a physical therapist in Australia and a great pain researcher. And so this study is one of his from about a decade ago, just over a decade ago. And in this study, they recruited people to the study to have a very, very cold temperature stimulus put on the back of their hand 22 times. So with this study, people were told, though, that the temperature stimulus would range from being very, very cold to very, very hot, and that they would be warned when it was ranging from warm through to hot, that they would be warned with a red light. And if it was going to be cool down to very, very cold, they would be warned with a blue light. So they were told that it would change in temperature and asked to rate how warm or cold it was, how painful it was, how bothersome it was. But in reality, the temperature was exactly the same every single time. So interestingly enough, what people reported is that when they saw the red light, they experienced much more pain than when they saw the blue light. It would be interesting to redo this study in Saskatchewan and see if people felt the same. I know I would probably rate it as more painful if it was cold. And so it's interesting that in Australia, people possibly were more fearful of extreme heat temperatures and rated it as much more painful, not because there was a change in the stimulus and not because there was any tissue damage done to the back of their hand, but they perceived it as much more threatening and therefore perceived it as more painful. The second study I want to tell you about is one of mine that was also done about almost a decade ago. And in this study, we recruited young people with arthritis, and we asked them to rate their pain and other symptoms and their mood 7 times a day over a 4-day period. So these graphs show 4 different young people who took part in the study and how their pain changed throughout the day. And so the young people would answer these questions on a little iPod Touch. The survey was on, it would sound an alarm, and every 2 hours they would answer these questions. And we also attached accelerometers to them so we could see how their physical activity changed throughout the day to see if their activity was maybe contributing to changes in their pain. And what we found is for these young people that it was normal for them to experience wide changes in their pain, a lot of variability in their symptoms. So if you think about it, for young people with arthritis, if I were to ask a room full of rheumatologists what was causing pain in young people with arthritis, they would probably talk about the pathology. They'd talk about the inflammation in the joint or the degeneration of the cartilage or the changes in the bone or changes in the blood flow around the joint and all of those kinds of pathological changes that they point to. But in reality, the pathology in the joint isn't changing drastically from 10 o'clock in the morning until noon. The pathology is pretty much staying relatively the same throughout the day, but their pain can change widely. We're going from 0 up to an 8 on a 0 to 10 scale. So it's not necessarily the pathology that's changing or contributing to fluctuations in pain or change in chronic pain over time, but it's a lot of the other contextual factors that people find themselves in. So in this study, we found a really strong correlation between mood and pain. So the happier a child was, the lower their pain score was. The sadder the child was, the higher their pain score was. And so that was one of the strongest correlations that we found in this study. So it's interesting to note that it's not necessarily the pathology that's changing the pain, but the changes in pain are related to a lot of other factors that the person is experiencing. So very simply put, pain is a product of our nervous system that keeps us alert to possible danger, pain is influenced by not just biological factors like tissue damage or inflammation, but it's also influenced by psychological factors, what we think about pain, what mood we're in, what our physical and social environments are like as well, and the context that we find ourselves in. So essentially anything that increases your sense of danger will worsen your pain, and anything that decreases your sense of danger will improve your pain. And if you think of your own pain right now, you may have noticed that the more stressed or fearful you are, the worse your pain can be. But the more you focus on things that make you happy or being well, taking good care of your mental and physical and spiritual health, the better your pain feels. So, and this is true of both acute pain as well as chronic pain, and probably even more so with chronic pain, that the psychological and contextual factors have more of an influence than the biological ones. So when we think about treatment, we need to think about all of these different aspects and addressing all of these different aspects. It's very important that you understand, though, that I'm not just saying that you need to just be happy or just think of other things to make your pain go away. It is absolutely not that simple. But what I'm saying is that we need to also focus not just on the biological factors, but also on the psychological and the social and environmental factors as well when we consider treatments. So the nervous system with someone with chronic pain is different, and it behaves in a different way. The most exciting thing that we've learned about pain in the last 10 years is that the nervous system, this high alert nervous system for people with chronic pain, can change. So though it behaves differently, and part of it is related to genetic factors, we can turn down the high alert of the nervous system so that somebody living with chronic pain can experience less pain. And there's no end point to that. That can happen at any point in someone's pain journey. And I'm not saying that that's easy. It's usually really difficult things like changing physical activity levels, improving sleep patterns, and those are hard things to change. But if we consider pain as a chronic disease and treat it like that, we can address pain and help people living with chronic pain to live better. So just like someone who lives with arthritis or diabetes, heart disease, these are chronic diseases. They need good medical management, and people need self-management skills as well, and a range of treatments. Similar for people with chronic pain, it's a chronic disease. And so we need good, well-trained healthcare providers who can provide good advice to people. And quite often, pain management will be addressed by these 4 categories, what we call the 4 Ps. So it may involve preventative measures like improving sleep, improving diet, as well as walking aids or braces and splints sometimes. It can include psychological strategies like cognitive behavioral therapy, relaxation training, mindfulness-based stress reduction, treatments like that. It will involve physical treatments like movement or manual therapies or acupuncture, or even heat or cold may be useful to a certain extent. And as well, some people may benefit from pharmaceutical interventions, so medications or injections. And of course, each person living with chronic pain will require a different combination of treatments, and the types of treatments we require over time will change as well, because our pain quite often changes over time. So I just wanted to highlight one resource for people to be aware of. There's a website, saspain.ca, that people can go to and find out about resources that are available in the province for people living with pain, and you can find out more information about activities and events happening in your area as well. For healthcare providers, there's information on education sessions that they can take part in, and there's also information on research projects that are taking place in the province as well. And so I'd like to thank you for your attention and hope you enjoy the rest of the presentation. Thank you.
Thank you, Susan. That was excellent. Our next presenter is Katherine Koskie. Katherine lives with chronic pain and will be sharing her story. Katherine was born and grew up in Yorkton. She has taught high school in Yorkton and surrounding areas for the last 6 years. Katherine is currently pursuing her PhD in secondary education at the University of Alberta.
Hi everyone, my name is Katherine. I'm 30 years old. I'm currently in Alberta, but I just moved here last year. I'm pursuing my PhD, and I'm just here to provide a brief history of my chronic pain story and perhaps some advice to those who are suffering from chronic pain. My chronic pain started in November of 2017, and I'd always had lower back pain that was a bit abnormal for a younger person, but was never debilitating. And starting in that November of 2017, I started to have back spasms, which was really abnormal. And I remember sitting in my classroom and I had to lay on the floor because my back was spasming. So it was a very different level of pain that I was experiencing. So I started doing chiropractic 2 times a week, and I had gone to chiro before here and there. And I also went to massage therapy bi-weekly. So this managed my pain for a while. I still had back pain, but the spasms went away. And then in the summer of 2018, I traveled to Belgium and a few other places in Europe, and I noticed that I was getting an immense amount of pain in my legs from walking, especially if it was on an incline. And for someone who travels every summer, that was also an abnormal level of pain. I usually can walk pretty far without pain, and I actually backpack. So I was surprised that I was hurting so much. So when I was traveling, I probably had massages like 4 times a week just because it was a school credit trip and I needed to keep going to things. And then, myself being myself said, well, once you're in Germany, like you should do the hikes that are cool. So I felt like my pain was like manageable still. When I went hiking, I felt okay, but when I came back, that's when things really got bad. So my knees were very swollen, I wore a brace, and my pain eventually, I would say in the next couple months, started to localize in my sort of like glute and lower back area. So at this point, I was doing everything I could. Physio, massage, I went to the doctor, and I was sort of, I would say, like thrown around a little bit. Like a few people thought it was my pelvis, a few other people thought it was my hip, and some people thought it was my leg. And so they all gave me different exercises. Some of them were repetitive, so I guess that's good, but I was seeing no real improvements. And at this point, it really localized on the right side of my hip. And I would say I lived about, for sure, at least a year and a half of really, really debilitating hip pain. So much so that I couldn't sleep on my right side, and it was difficult to sleep on my left side. So anyway, eventually I explained this to my chiropractor, and he sent me to this foot doctor person. I don't know what they're called. And the foot doctor was like, nope, your feet are fine, but your hip is messed up. And he found that out through a range of motion exercises. So then I was referred to a sports medicine doctor in Regina, and he said that I had hip bursitis. So at that point, I did receive a shot of steroids or something of the like in my hip, and that was sort of a huge relief in pain. But he had told me that that was a temporary fix, and I needed to figure out my core issue. So I booked into a bunch of other physiotherapists, and eventually I found one who really honestly changed my life. Her name is Suzanne Funk. She's in Regina, Saskatchewan. And she diagnosed the main issue, and I left my first appointment with about an 80% reduction in pain, and my second appointment with about a 90% reduction in pain. And a lot of it had to do with internal pelvic muscles and my pelvic floor being tilted and rotated. And so all the physio I was doing, all the massage I was doing, everything I was doing wasn't going to work because I wasn't fixing the main issue, and my muscles were continuing to go back into that learned place. So one of the questions that was asked is, how did pain impact my life? I sort of, like I said, when it was at my worst, I wasn't sleeping. So you can imagine all the things that happen when you're not sleeping. It's really not good. And I'm a high school teacher, so my job is difficult to be patient enough. And I found it a lot more difficult to be at work for a number of reasons. But there's a few distinct things I remember. It built so slowly over time. This pain built so slowly that I didn't notice how bad it was. And then there's a few moments, like I was traveling in Montreal with my significant other, and I was just crying. I was trying to walk up this hill, and I just couldn't walk up this hill. And I was like, what? I'm a traveler. Like, this hill is nothing. I was very upset. I also had a lot of weight gain. I was exhausted all the time. It impacted my relationships, my reactions, my emotions. And I did truly feel like a lot of my pain was disregarded and dismissed by people, both inside and outside the healthcare system. So, I had heard from doctors like, oh, well, you just need to lose weight. And it's like, well, I can't sleep, so how do you lose weight? When you can't sleep and your body is, it's completely stressed all the time. Or, sort of comments that dismissed pain in the sense of like, oh, well, just wait until you're 60 and you'll really know what hip pain is. And I know that those comments aren't meant to be mean, but I don't think I had a typical, 27-year-old hip. So it was frustrating. But it was especially frustrating when I didn't believe that doctors believed my pain, because I knew that something was wrong. And it's hard because I think sometimes you feel inadequate. You don't have the education background. You just know that something's wrong. So, my biggest advice is to advocate for yourself and don't accept temporary relief forever. I know that's a privileged position to take because I did have money. I do have a lot of different privileges, socioeconomic, race, etc., that, allow me. I have a supportive family that really told me like, no, there's something wrong here, and pushed me to advocate for myself. So there were doctor's appointments that were uncomfortable. I asked for things they didn't necessarily want to give me. And even though that itself maybe didn't create relief, I think it helped because that's how I eventually got to the right person, the right physiotherapist. So yeah, that is sort of what my story is. I would say that right now I'm really taking the time during this pandemic to listen to my body a lot more. If I'm feeling sore, I no longer just let it be like, oh, that's a normal threshold of pain. I go to physio, I go to massage, I do my stretches. And so those are some of the things that I'm really not taking for granted anymore. And yeah, I hope this was helpful or not. But either way, thanks for listening, and I hope you all have a fantastic summer or whatever season it is, I guess, when you look at this.
Thank you, Katherine, for sharing your experience with us today. Our final speaker is Michelle Eckhart. Michelle will lead us through a breathing activity. Michelle Eckhart is a registered social worker who resides in Springside, Saskatchewan with her husband, 2 girls, and a dog and cat. She has a genuine passion for helping others to learn to help themselves. An avid Riders fan, She cannot wait till the CFL starts so she can wear a watermelon on her head again.
The reason why we want to look at breathing is breathing can help with relaxation. It can help promote oxygen flowing through our bodies to help with some of those natural chemicals that happen in our body, endorphins, as we get into a state of relaxation. So today I'm going to explain how deep breathing works, why it's good, and give you some examples on how you can use it in your daily life. So today, so this is based on research that I have done over the years with breathing. I use this a lot with my clients. I practice as a social worker and mental health therapist in Yorkton in primary health. So I do work with a lot of individuals that are living with chronic pain. I don't live with chronic pain myself, but I do have loved ones that do. So I'm very aware of how this can help with them. Personally and professionally, I use breathing to help with relaxation for myself. And so I use breathing a lot when I have a hard time sleeping and to get into a state of relaxation. Part of my job is very stressful. And so I use breathing as a way to help relax at the end of the day and at the beginning of the day. I try to do breathing at the beginning of my day to set the tone for the day and help with that. So I'm going to explain a little bit of the mechanics behind breathing and then get into some different exercises to show you how to breathe. And then I'm going to give you some other resources that you can check out on your own. So the first thing I want to talk about is how we breathe. So when we breathe, we want to not be focusing on apical breathing, which is up here for us, okay? So when we look at diaphragmatic breathing, we're not going to be breathing from here up. We're going to be breathing from where your belly button is, just above where your diaphragm is, and up. So what I'm going to get you to do is to take one hand, put it on your belly button, just up, and then the other hand and put it on your chest or over your heart, okay? And I'm just going to get you to breathe and just notice how that feels. If your hands are moving, if both of them are moving, or just one, right? You should feel both, okay? Now, when we're diaphragmatic breathing, when we inhale, our diaphragm lowers to allow air to enter our lungs. And so we should feel that, and we should feel our lungs fill and out. And then our diaphragm rises because that muscle that sits between our lungs and our digestive system helps to allow that assistance in the breathing, okay? Now, when we take very narrow and shallow breaths, called apical breathing, I can't really get a hold of my breath, right? And so sometimes we do that, right? We get caught in a, and then all of a sudden, when we start breathing really shallowly, we can start to hyperventilate. And then we get into a state of anxiety. And then we are even more unnerved, right? And that sometimes happens when we're in pain, is that apical breathing becomes omnipresent because what's happening is it just hurts too much to breathe that much. So what I encourage you to do right now is just to find a comfortable spot. I hope you're watching this in a comfortable spot. And I want you to just kind of pull your shoulders up and back and relax and just kind of let your hands droop beside you, okay? Shoulders down. We're just gonna do a little bit of relax. I'm just loosening my neck up a bit, okay? I'm gonna just put a little bit of music on. So some people find music helpful, okay? So as we're breathing, we want to focus on some breathing here, okay? So the first one we're going to look at is square breathing. So like it says, it's a square. So what we're going to do is we're going to breathe in for 4, hold for 4, out for 4, and hold for 4. So as we're breathing, okay, we're going to, so you can trace a square in front of you on your finger, on your hand, okay? And so we're going to start at the bottom right of the square, okay? And I'm going to count, and we're going to breathe in for 4, hold for 4, out for 4, hold for 4. And if you can't do this, try breathe in, and when I say hold for 4, breathe out, okay? Or do it for 2, whatever works for you, okay? Just for example today, I'm going to use the 4, okay? So we're going to breathe in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4, in, 2, 3, 4, hold, 2, 3, 4, out, 2, 3, 4, hold, 2, 3, 4. Okay, so that's just gonna allow you, okay, and as you're breathing, you're gonna want to trace that square. What the square does sometimes to trace, when we trace it, it allows us to have our finger something else to focus on besides the breath, because sometimes it's hard to stay in that mindset. We can also look at triangle breathing. So where we are looking at holding for 3, or in for 3, hold for 3, out for 3. Okay, so we're going to breathe in for 3, 2, 3, hold, 2, 3, out, 2, 3, in, 2, 3, hold, 2, 3, out, 2, 3, in, 2, 3, hold, 2, 3, out, 2, 3, in, 2, 3, hold, 2, 3, out, 2, 3. Okay, so that's another one you can try. And then there's pursed lip breathing, which is an exercise that can help us slow our breathing down and help us relax. So this can help when we're outside with exercising, climbing stairs, or need help calming down, okay? Especially in summer. As I'm recording this today, it's the middle of June, and the last few days has been very unseasonably hot. And so when I was outside jogging the other day, I needed to be able to breathe with my pursed lip breathing, okay? And jogging by, I mean 1 block. I'm slowly walking and jogging. So I use pursed lip breathing a lot, okay? And so we're gonna relax our necks and shoulder muscles again. Okay, so we're gonna breathe in slowly through our nose like we're smelling the roses. And then we're gonna purse our lips like we're gonna blow a whistle. And it's gonna come out slowly, right? So it's almost like a balloon deflating or pushing a candle out, okay? So we're gonna bring our nose open, and we're gonna breathe in deeply, like we're smelling the roses or smelling a flower. And then we're going to relax and push it out. This can also help that suffer from COPD, asthma, other breathing difficulties, to help control any breathing that can help, right? Because it's letting it out slower rather than when we let it out like, let's all out at once. When we use pursed lip breathing, we're going and we're redirecting it, and it's allowing the lungs to empty a little slower, which is allowing the oxygen to stay in our body a little longer. Deep breathing is also very good for falling asleep if you have a hard time with sleep. It is very helpful. A few helpful phone applications that you can use for breathing. So one is called Breathe to Relax, and this is a portable stress management tool that you can use. So if you have a phone, it's free on both Android and Apple phones. And so the Breathe to Relax works a little differently. And so you can set it up and then you just hit breathe. It's going to give you a quick little like, how are you feeling? Are you feeling relaxed or stressed? So I'm going to put, I'm feeling a little stressed right now, because sometimes presentations make me feel a little bit nervous. And then it's going to give me a nice pretty scene of some trees and a forest, and it's going to ask me to start. So I'm going to hit start. And it's going to encourage me to breathe in and out. And you can lengthen and shorten the exhale and inhale. Okay.
Breathe in by taking air deep into your belly. Breathe out slowly. Pause naturally.
And it goes through a cycle of 16 breaths. Okay. Has the music. And then when you're done, it gets you to track, see how your mood is again. Okay. And you can change it up.
As you end this exercise, you can continue to allow your breathing to be deeper and slower. Take your time as you slowly turn your attention.
And it has a nice calming voice. So that's one thing you can try. Mindshift is another great app that you can use that has some deep breathing exercises on it, quick relief breathing, has anxiety tracker. And so sometimes when we're dealing with chronic pain, we can be dealing with anxiety and depression as well. And so this can help with some of those pieces. It has some tools that you could be using, and it has a lot of education pieces on it too to help with that. Insight Timer is a meditation app with over 20,000 available meditations. It is free, but there is a pay option as well too, and you can filter based upon what type of meditation you'd like, what type of music, that kind of thing. And Calm. So sleep meditation and relaxations are in your hands with Calm. So once again, this is a free and a pay. And so it has some relaxation exercises in there. It has some stories in there, bedtime sleep stories, those types of things. So does Insight Timer as well. Sleep is really, really important when it comes to dealing with chronic pain, especially when we have a hard time with sleeping. Okay. So on the handout, it does include my email and my phone number. So if you do wish to reach out, you are more than welcome to. And we can discuss this more if you'd like. I do accept referrals in the southeast area. So around Yorkton, Melville, Foam Lake, Wynyard, Kenora, Kamsack, Norquay, Priestville. So you can give me a call or email if you have questions. And thank you for joining me today. And I hope you learned a lot about breathing.
Thank you, Michelle. That was excellent. That brings our first Partners in Pain session to a close. Thank you again to all of our speakers and to all of you for joining us. Please join us next week, March 17th, for the next Partners in Pain session, where we will be discussing treating chronic pain. Have a great week, everyone, and thanks again for being here.